Good afternoon, everyone. So that's just another example of how digital assistive technology can change things. But there are other aspects to this as well, around not just digital assistive technology, but digital technology more generally that can really be life-changing, especially in lower and middle-income countries where sometimes access can be difficult to have, especially in remote areas and things like that. Kylie, you coming from WHO, look at things from a systems perspective, a very holistic perspective. As I mentioned before, AT is about the product, but also the services that come along with it. Can you speak a little bit more about that, and also how digital technology can really expand the reach of, for example, healthcare?
Yeah, of course. Thanks, Pascal. And you've made a really good point that digital assistive technology is not just about the products. We've had a great example of a product from Ali, and then of course the other one around Voice It. And there are many, many different digital products that are assistive products. But when we talk about this whole area of digital assistive technology, we're thinking about how technology itself can be harnessed in order to increase access across the whole ecosystem that is required in order for people to be able to access the assistive products that they need. And at WHO, we can describe that entire ecosystem just using 5 simple Ps. So we put people at the centre, so that's our first P. We think about the policy frameworks that are needed that will help to ensure that there are not, unforeseen barriers to access. We think about the provision systems that are really important to make sure that people get the support that they need and that the services reach them to be able to access the right product for their specific requirements. And then we need to think about the products, of course, so that's a 4th P, and the procurement, which sort of fits in under there, and the personnel. So the workforce that we really need to be able to upskill to be able to support access. And I think I'll just give you one example of digital technology helping to solve challenges or barriers across the 5 Ps. So let's just take policy, for example. We know that policy is weak in many of the countries, high, low, middle-income countries. Policy support for assistive technology is not strong. But in order to strengthen policy, we need really good data. And of course, we can use digital technology to be able to improve the speed and the efficiency with which we can collect data about the need, the unmet need, about people's perceptions of the products that are available, and we can use that, we can analyse it, and we can use it to be able to better inform the policy framework that needs to be strengthened. So that's just one example of thinking about the challenges across the whole ecosystem, the potential digital solution, and what the outcome for that might be in terms of increasing access.
Thanks, Kylie, and maybe just to share what
help with each other.
Thank you, Rima, and I'd love you to say a few more words in a second about the Edison Alliance initiative. But maybe back to you, Kylie. We've already heard a few of the barriers that exist, or some of the requirements that need to be there, usability, affordability, etc. But can you, from your experience on the ground as well and so forth, can you speak to what are some of the very practical barriers that we really need to overcome to increase access, in particular in lower and middle-income countries?
Okay, thanks, Pascal. And if anyone's really interested in, what are the big ticket barriers that are preventing people in lower middle-income countries from having access, the Global Report on Assistive Technology, which was launched in 2022, provides a really good summary. And you've already touched on one of the very major challenges, which is distance to services. So we know that globally there are about 2.5 billion people that need assistive technology. So that's 1 in 3 of us. But in low-income countries, access is very limited. And a lot of this is due to the fact that the majority of assistive technology services are in urban centres. And that's not where the majority of people in low-income countries, low-middle-income countries live. So that distance that they need to travel in order to access a person and a service and a product that will meet their needs is beyond the capability of people to reach. And there's a couple of things that can be done about that, and digital solutions can support. So one of them is providing better information where there's connectivity, so people can find out more and overcome the barrier of a lack of awareness and understanding of the products that might be available to them through online platforms. And we've seen some incredible transformation happening in China, for example, where they have a nationwide online platform that people can access from anywhere in the country in order to understand the different products that are available to them. And through that platform, they can connect to services. The other types of technology that can support is the use of telehealth, which can really bridge that gap. So, we had the example of the prosthetics, but also fulfilling elements of the service delivery, such as follow-up. That can be done through telehealth. And that might be the service provider connecting with the service user, or it could be the service provider in the more higher level, tertiary level service, connecting to a primary health or community health worker and providing them with the support and the knowledge that's required for them to then support their community member in their access. And I think I'll just touch briefly on workforce shortage. So we know that health systems across low and middle income countries are challenged to meet the services that are needed by the breadth of, the breadth of services for the population. So bringing assistive technology into that service is a real challenge. But with digital technology, we can streamline some of the processes and the steps, and we can shorten the time that's required from a health personnel to deliver a service. For example, using an app to carry out aspects of screening, or using AI to help with some of the complex decision making. I mean, this is sort of more futuristic type work, but it is there and it's possible, and it can help us to bridge some of the major gaps in terms of access when we have the connectivity. Okay.
So maybe then back to you, Rima and Kylie.
I think to add to stick to basics, I would say keep it real. Here we are, but we are thousands and thousands of miles away from the sort of low-income country settings that I think about when I think about increasing access to assistive technology. And so if we're innovating and thinking about potential solutions, particularly digital solutions, my thought there is that we need to focus on what is the major priority challenge that a country itself needs to solve, and use digital technology to solve those country-led challenges. And that means really speaking on the ground to the service users, the service providers, and the government, because honestly, real system change won't happen unless the government is on board, and therefore we need to be thinking about how digital solutions integrate within health systems. From WHO, I'm going to talk about assistive technology in the context of a health service, but we need to be thinking about what is the most important challenge that digital technology can support, and work there, and avoid working in silos, which again I think mirrors a little bit about what's been said already. Thanks.
Thank you, Kylie. Focusing on countries, governments, and avoiding the silos.
Yeah.